Okay, let's imagine you're in a meeting at work. You had a great night's sleep, you've had your coffee, you feel fantastic. And then someone leans over and they say, "Hey, are you okay? You look exhausted." The thing is, your eyelids might actually be the problem, and there is a fix for it. I'm going to walk you through the 5 signs that your eyelids might need a fix, and stay with me for sign number 4, because that's the one that surprises almost every patient who sits down in my office, and it's also the one that most doctors completely miss. I'm Dr. Keon Eftekari, Oculofacial Plastic Surgeon at the Eyelids Center of Utah. My entire practice is eyelids, so when I say I've heard these stories before, I mean I've heard them thousands of times. And most of the time, there's a real anatomical explanation behind every single one. Quick note before we get into the signs. This video is not meant to scare you into getting surgery. Not everyone who recognizes these things needs an operation. Some of this points to surgery, some points to simpler solutions, and some just means it's worth getting a proper evaluation so you actually know what you're working with. The goal here is to give you enough information to stop guessing and start having a real conversation with a qualified surgeon. That's it, okay? Now let's get into it. Sign number 1, you look tired even when you're not feeling tired. This is the one I hear the most, almost daily. Patients come in and they say some version of the same thing. I don't feel tired, but everyone tells me I'm tired, or I've tried every eye cream on the market and nothing makes a difference. Here's why that happens and why that eye cream isn't working. The tired look is almost never about skin texture or true swelling and puffiness. Under eye bags, where you get dark circles under your eyes, is almost always a structural issue with the fat or the lack of fat along your cheekbone. I will explain. The key thing to understand is that this is structural. It's not a hydration problem where you're not drinking enough water. It's not a sleep problem. It's about the anatomy of the under eye area. We all have fat in our eye sockets, and as we get older, the elastic under our eyes stretches out and those fat pockets kind of pooch forward and bulge. Now look for this under your eyelashes but above the cheekbone, so in this area here. If there's a bulge there, it's most commonly fat. The second reason for dark circles is the lack of fat along your cheekbone. So if you are hollow along here, which happens to all of us as we get older, that is only going to make the bulge just above it even more pronounced. The analogy I use with my patients is to think of the bulge above like a speed bump and the hollow below like a dip in the road. If those two are right next to each other, then it's going to really emphasize the dark circle, or in our analogy, the cars would just be flying over it. No amount of concealer is going to fill in the dip in the road or flatten the speed bump. Unfortunately, especially in a Zoom world that we live in, this dark circle under eye appearance shapes how others perceive you before you've even said a single word. The takeaway here, if people keep telling you that you look tired and you're not feeling tired, the eye cream alone is not going to fix it. Sign number 2 is one I find genuinely underdiagnosed, and it's this. You're using your forehead to see. Most people have no idea that this is happening, but here's the giveaway. Do you have horizontal lines across your forehead that formed a little earlier than you expected? Do you get tension headaches? Not migraines, just that dull, persistent pressure across your eyebrow, especially later in the day. Or do you ever notice yourself tilting your chin up slightly just to see better? All of those are compensation signals for a droopy eyelid, because honestly, the position of your eyelids actually conveys emotion to other people. When your upper eyelid sits too low, others read it as tired, angry, or grumpy, which is usually not how you actually feel on the inside, or maybe it is. When part of your upper eyelid covers the colored part of your eye, your iris, our brains read that as heavy, closed, and tired looking. The causes are the same 3 I talk about all the time on this channel. A sagging eyebrow pushing everything down, too much upper eyelid skin folding over the eyelash line, or a stretched out eye muscle, the levator muscle that lifts your eyelid, that just can't pull the eyelid up to where it should be. Think of it like a Roman shade with a worn out or stretched cord. The shade might be fine, but the mechanism that's supposed to lift it is stretched out and tired. Sometimes it's one of these things, sometimes it's a combination. And when the eyelid is sitting too low, whether because of a sagging eyebrow, excess skin, or a weak muscle, your brain doesn't just accept the reduction in vision and move on. It recruits other muscles to compensate, like the frontalis muscle, which runs up your forehead. Your brain tells that muscle to pull up like a pilot to help lift things up so you can see better. Mayday, mayday. If you run that muscle all day long without realizing how much you're using it, then it gets tired. That's where the tension headaches can come in and those horizontal wrinkles. Now you understand those too. The funny thing is, a lot of times people will come to me asking for Botox to smooth those forehead lines, but what is actually going on is that they have an underlying eyelid droop instead, because the lines weren't the cause of the problem, the lines were the symptom. The takeaway is, if you've got forehead lines or tension headaches, your forehead might actually be doing your eyelid's job. And no amount of Botox is gonna fix a droopy eyelid. It'll actually just make it worse. Sign number 3, photos just don't look like you. And here's where it gets weird, because if your forehead is doing all that work, there's one place where it stops doing it, and that's where most people first notice something is wrong: photos. Sign number 3 is that photos just don't look like you. And there's a real reason for that, not just a bad angle. Here's the short version. When you look in a mirror, your brain compensates. It subtly fires your forehead muscle, lifts your eyebrows, opens your eyes slightly more than their true resting position. You look like you. But when somebody takes a photo, we often smile. And smiling relaxes the forehead. So all the eyelid problems that are sitting underneath start to get uncovered. And you notice them when you look at the photo. The photo catches you relaxing your forehead, which shows your true resting eyelid position, which sometimes can be significantly more closed than when you look in the mirror. So if you've been in a war with cameras your whole adult life, and you've assumed it's always the angle or the lighting, it might actually be your eyelids. And the fact that it happens in every photo, regardless of the photographer, is a sign that's worth paying attention to. I actually did an entire video breaking down the mirror versus camera mechanism, and I'll link it here if you want to go deeper on that one after this video. The takeaway is, if you look like a different person in photos than you do in the mirror, the camera probably isn't lying. The mirror is. Sign number 4. Okay, this is the one I mentioned at the start, and I really want you to listen to this one. Your peripheral vision might be getting blocked, and you might have no idea. Here's why that one gets missed. Visual field loss from eyelid problems is gradual. It doesn't happen overnight. Your skin doesn't suddenly fall down over your eye on a Tuesday, despite what some of my patients might think. It creeps down over months and years, and your brain is remarkably good at adapting to those gradual changes, filling in, compensating, adjusting. By the time it's clinically significant, most people have been living with it for so long that it just feels normal. The area that gets blocked first is always the upper and outer visual field, the part of your vision in the top corners. In real life, this is how it shows up. Patients come into my office and they tell me that they don't feel as safe driving, or they run into the cabinet door that they didn't notice was open, or they don't see someone walking right up to them until that person is standing right in front of them. In my office, I test your peripheral visual field, and this is standard practice before any functional eyelid surgery, and some patients are totally shocked by how much vision that they actually are missing. And when we can document actual visual field loss, some eyelid surgeries might be covered by your insurance. I'm not gonna make any promises on that. If you wanna go deeper on this, check out my other video on insurance coverage. Here's a quick self-check you can do right now. Imagine you're sitting in this museum and you can see everything on the walls. Now close your eyes and physically push down your forehead wrinkles so you can get them to relax. Now I'm gonna warn you, when I tell you to open your eyes, you will naturally want to fire the forehead first, but resist this temptation. Try to open your eyes with just your eyelashes, as if you're looking out from under something. Try to look straight in front of you, not down at a book, and tell me if you feel like something is missing in your vision up above. Is the museum starting to look more like this? If you're noticing a difference, then it's worth getting tested properly with a formal exam. The takeaway, visual field loss from eyelid problems is gradual enough that your brain hides it from you. Most patients don't realize it until they're actually being tested. I want to pause here for a second and say something clearly because I think it's important. Not everyone watching this needs surgery. Some of these signs are serious enough that surgery really is the right answer. Some of them are just worth monitoring and checking on once a year. The reason I make these videos is this. I can't tell you how many times people come into my office, they realize what's up with their eyelids, and they stare at me shocked when they realize that this is actually a fixable problem. It's been affecting their confidence, their vision, or their quality of life, and they often tell me after surgery that they wish they had gotten it fixed years ago. That is genuinely frustrating to me. You deserve a diagnosis before someone offers you a solution. That's the whole point. All right, sign number 5, and this one reframes everything. What if your eyes are chronically dry, irritated, or hard to fully close at night? Most people connect eyelid surgery to appearance, cosmesis. Fewer people connect it to actual health of the eye. But the lower eyelid position directly affects how your tear film works and how well your cornea, the front of the eye, stays protected. And when the eyelid isn't functioning the way it's supposed to, the eyeball can pay a price. Here's an example. Sometimes what happens is that as we get older and we get a lot of sun, the cheek skin tightens and contracts, and that can pull down the lower eyelid. Think of like a basset hound. People with this condition often wake up with red, gritty, irritated eyes every single morning, and they have no idea why. They go through bottle after bottle of artificial tears. Some of them have been told that they just have had dry eye for years. And yes, they do have dry eye, but it's being caused by something structural that plain artificial tears can't fix. In a severe situation, this can mean the eyelids don't even close at all and they become permanently pulled down. This can happen sometimes when too much skin has been removed from a prior surgery, or sometimes just how someone ages and how much sun exposure they get. When the eye doesn't close completely, it dries out, and over time it can cause real damage to the surface of the eye. The through line in all of this is that the surgery isn't just about aesthetics, it can also be about function. It's about protecting the eye. And I think that's worth knowing because a lot of people dismiss the idea of eyelid surgery as vanity, especially men, when in some cases it's genuinely reconstructive and can actually help you see better. The takeaway is if your dry eye drops are not working, the problem might not be your tears, it might be your eyelid position. So there are your 5 signs. Number 1, you look tired when you're not. Number 2, you're using your forehead to see. Number 3, photos just don't look like you. Number 4, your peripheral vision is being blocked. And number 5, your eyes are dry, irritated, or struggling to close. If any one of these hit you somewhere, drop a comment and tell me which one. I do read them. And if it's multiple at once, that's also useful information and worth getting an evaluation. If you want a full breakdown of the anatomy of why the eyelid droops in the first place, I've got a video on exactly that linked right here. And for everything about the camera versus mirror disconnect from sign number 3, that video is linked here as well. If you want to come in and get a proper evaluation, go to eyelid.pro/book. Subscribe for more videos like this one. I'll see you in the next one.